when we move from early infancy or towards the birthday onwards, we need to reduce our milk intake and progress with more healthy diet. Milk intake twice a day should be adequate in most babies. If you're continuing to breastfeed your baby, say till 2 years of age, you still reduce the frequency of breastfeeding. Remember that milk stays in contact with the teeth longer when the baby is sucking, and so it's not good for their evolving dentition as well if they repeatedly keep feeding. So one of the advice we give the parents to improve their dental hygiene is to reduce the frequency both during the day and during the night. During the day, actually, the child who is not on breastfeeds doesn't need any milk feeds. You can give the milk in the morning, then they can have their breakfast, lunch and dinner, maybe one snack in between, followed by milk before they go to sleep. So 2 milk feeds followed by 3 solid meals and 1 snack should be a reasonable pattern for this age. Picky eating as well starts from your feeding practices from early infancy. So you can look at obviously the ways to reduce it when they are managing their eating habits when they are young. Focus on giving them healthy options and on a consistent basis. So don't push them to finish. Go by their growth chart to some extent. Discuss with the pediatrician what their growth level is. And if they are already eating well and they are growing well, don't change it much. The introduction of new foods sometimes leads to conflict. Again, you don't need to force it on them. If they like it, you proceed with it. If they're not keen on it, you take a step back. And I often tell my families that if you have a child eating one form of healthy food, it's a balanced diet, but they refuse another form, there is no need to force that other form on them for some time. There are situations where you can encourage them to eat it, like sharing from a sibling's plate or some form of competing with parents or other members of the family when they're eating. So this encourages them. The same competition response can be used when there is reluctance to brush the teeth. For example, you can get them to brush the teeth along with the siblings, so they are likely to do it better. So these are techniques you can use to encourage them. There are days when the child doesn't want to eat much, especially if they have a cold or they're slightly unwell or they're engaged in very high activity, so they're distracted. So you may not want to force them to eat. Again, don't give substitutes when they don't eat their meal. So don't give milk just because they didn't eat their meal or they didn't eat it adequately. So the question of adequate is defined by us. So it's not easy to define what is adequate for a particular child. As long as they're growing well, some fluctuation in eating is normal. You can review the video I have on picky eating for further tips as well. But most of the tussle happens because there is a discrepancy between what the child needs and what the parent thinks they need. And also the likes and dislikes are stressed too much, and the variety is stressed too much as well. You don't really need variety if the child is eating good food. So don't disturb the pattern too much just because you feel something new has to come in. Avoid sweets and crispy food which are having processed food. Don't give fizzy drinks to children, and juices are not very healthy foods either. So if you can avoid juices as far as possible, it's good. Fiber intake is important because when they don't eat adequate fiber, they get constipated, and this leads to an ongoing cycle of problems. Water intake should be focused on because inadequate water intake can lead to problems like constipation. Urinary tract infections can be increasing as well. Toilet training is a period when there is conflict, and obviously the child should not be forced to toilet train. You engage it, you bring it up in a reasonably slow pattern.